I now give the floor to the Honourable Minister for Health and Medical Services, the Honourable Dr. Ephraim Wangarimbete. You have the floor, sir.
Honourable Speaker, and I thank the Honourable Member for that question. As we speak, Honourable Speaker, the Cath Lab is working very well in CWM, the current Cath Lab that we have. Not only is working very well, it's also serving our people and looking after our people. The previous Cath Lab was installed in 2009 and in 2010. And this was through a collaboration between Dr. Vijay Kapadia, his group, the Rotary Club, and also the group in Australia, who have a vested interest in the training of our staff. And so that Cath Lab served us well throughout that time. It was also involved in the training of our 3 cardiologists, including our 2 intensive interventional cardiologists that we now have. During that period of training, the team will come from overseas, and when they come, then the Cath Lab could open and work because they have to train under supervision. So it wasn't available all the time. It was only available during the time that our team came. And in 2020, the machine started having some issues and problems, and working with our biomedical technicians and Mr. Peter Cohen, who is a biomedical engineer, initially with Philips, but now doing his own consulting after retiring from Philips. He worked with us, and remotely we were able to fix issues as we went along. Unfortunately, it reached a stage where we could not fix it anymore, and the discussions were done on being able to bring forward the current machine that we have now that is working at CWM. Honourable Speaker, in 2009 and 2010, the Cath Lab at CWM was the only Cath Lab in the country. And throughout that period, with the tax incentives that have been put in place and the support to the private hospitals, we now have a Cath Lab also available in Oceania, and also Heart International, which we must also commend, because Heart International is a group of Fijians from New Zealand who have also a vested interest in our country, and Australians, and they've set up a Cath Lab in the West. What we've also done during the period that in between the last 1 to 2 years, when we've had some times when the Cath Lab wasn't working, those patients that we were able to pick up from the system, we were able to support them depending on the threshold in terms of their salaries, as we do with any other cases that we send overseas. We also have to realize, Honourable Speaker, that the Cath Lab has gone from a training Cath Lab for angiograms to now our fully qualified cardiologists who are able to do interventional cardiology. Moving forward, what we intend to do, and what the Fijian government and also the Minister for Economy has alluded to, is that we have Healthcare Fiji, which is coming online, and they will be offering cardiovascular services, including these cardiology services. We also have begun discussions, and we put it as a policy in the budget, that we'd like to outsource some of these interventional and also diagnostic work that's being done within the public hospital system. Because what it will do is a few things. Number one, it means that we're able to have this that we can actually look towards and go and utilize outside, but we can also ask them for a standard of care and also ensure that the biomedical equipment is actually has a service context and fixed on a regular basis. So, as I've alluded to earlier, we now have 3 areas in which cardiology services such as Cath Lab is available, and those are at the public system, at Oceania, and also at the Heart International. So if you are booking patients, and I presume that you're asking, the Honourable Member is asking a question whether it's a public patient and also whether it's a private patient, because you also have a private practice. So in the private practice, as you are aware, those patients can either be referred to us or referred into the private system. And the system is through the Fiji College of GPs, and also the links that you have with Oceania and also through FCGP to Heart International. With our system, the referral is the same. So that comes through, and it's triaged by Dr. Barat and also Dr. Sahin and Dr. Sukapa. And if it's coming from Taviuni, for example, then they will set dates in which the patient can come in and also receive their care. During the tea break, I was able to go up, and within that period, from the morning till about 10:30 when I was there, they had done 3 cases already. So certainly they are rolling. I think the other important thing that we must congratulate the team and also the government for supporting this is that we now have cardiology services at that level available now on a regular basis rather than waiting for the team to come from overseas. And Honorable Dr. Lalabala would understand that in the interim period, they had to wait until the team came to be able to do interventional cardiology services. But that's now available. And really, when you talk to them, there are three types of patients that they have. There are those that have an angiogram and they need intervention through stenting or angioplasty, those who need an open heart surgery, and those that may not need anything at all or cannot receive any other treatment. And even with the last Cath Lab, we considered that that's why we had the backup in Australia. And as I've alluded to in my previous reply to the Honourable Ngengere Tambua, the discussions were being held by the biomedical engineer in Australia with our technicians here remotely. And albeit remotely had some challenges. They sent across a computer that was different, but again, now that the borders are open, the ability to travel is actually much simpler.
Thank you. We'll move on. The next question.